Welcome, Noella Leydon.
Thank you.
As a dietitian, you recognized a very serious problem among seniors who live in residential care in the Saskatoon health area. What was that problem?
We found that about 49% of the population within 16 homes in Saskatoon were malnourished. And of that 49%, 80% needed assistance with their meals, with dining. And this compares to a national and actually international proportion of malnourished seniors in long-term care homes from 40 to 80%. So we found that we were really within the range that the literature reports. So we feel we have to have a systematic approach to improve the situation.
Now, it seems extraordinary that here in Canada, our seniors are malnourished. Why is there a problem in seniors' homes, which specialize in looking after the elderly?
The residents are declining in health, and they may have conditions such as dementia that severely affect their ability to eat, and they require assistance with eating. They may have diminished taste sensations. They may be generally unhealthy and require dining assistance, essentially. They also have to have food that looks appealing, has a good aroma, and they have to be encouraged to eat.
And some of those necessary conditions aren't found in the dining rooms of these?
Well, in the dining rooms, we want to make sure that there's not extra noise, the TV isn't on, there's pleasing colors, it's clean, there's no maintenance people fixing light bulbs or washing the floors outside the rooms while they're dining. That there's not a lot of hurry of the residents while they're dining. That they should stay in the dining room for at least 45 minutes so that they are ensured that they get an adequate intake.
What are the consequences of malnutrition in the elderly?
What can happen is they can be immunocompromised, or they may be more susceptible to infection. They may be more susceptible to falls. If they require additional calcium and vitamin D, especially vitamin D in the elderly, they may be more susceptible to pressure sores or pressure ulcers due to a lack of total energy and total protein intake. They may become dehydrated if they've had a lack of fluid intake.
So all those things we think of as being frailness in elderly, many of them are from malnutrition, is that right?
Yes, you could look at that as a major contributing factor.
What steps have you taken to deal with the problem?
What we're looking at is a team approach, a systematic approach within the 29 long-term care homes in Saskatoon health region. I did talk about the 16 homes, but in the rural areas we have a total of 29 homes with over 2,000 clients. So we're really looking at improving the staff training, improving the menu, and ensuring that those who require it receive nutritional advice and intervention.
What's your biggest challenge in this?
Well, first of all, is we have to ensure that everyone understands the depth and the breadth of malnutrition in long-term care. So a lot of education from an administrative to a director of care to frontline staff level is very, very important. What we've looked at is training at the frontline level in the long-term care dining room setting. And we have a 4-hour program that is designed by a speech-language pathologist and a dietitian to assist frontline staff in recognizing issues in the dining room, whether they're having difficulty swallowing, seeing the food, having a quiet dining environment, a pleasant dining atmosphere. All of that is identified as issues in this training program.
What can you accomplish with this? If this works, how will the patients benefit? How will residents benefit?
What we will be able to measure is the overall nutritional status on a quarterly basis in each home, their dental care issues, their pressure sore reduction and dehydration reduction. So we're measuring those 4 parameters so that we will be able to show that we've made a difference in care. So they should be able to enjoy a greater quality of life in their home.
Thank you very much.